today.
Hi, nice to meet you.
Nice to meet you. I'm just going to go ahead and wash my hands. So today we're going to be doing a head-to-toe assessment.
All right, wonderful.
Have you had one of those done before?
Yeah.
Okay, good. So you know what it's all about. We're just going to go from the top of your head all the way down to your toes.
Fantastic.
Are you able to verify your date of birth for me?
11/12/94.
Perfect. And that matches with the record. Just going to put on some gloves. So the first thing that I'm going to do is I'm just going to ask some questions.
Okay.
Okay? Can you give me your full name and date of birth?
Kayla Bozen, 11/12/94.
Perfect. And can you tell me where you are?
I'm in the sim lab.
Awesome. And can you tell me who the president is of the United States?
Joe Biden.
Wonderful. So as I said before, we're doing a head-to-toe assessment. So the first thing that I'm going to do is I'm going to start from the head and I'm going to work my way down to your toes, okay? We're going to touch base on all the body parts.
Okay.
So I'm going to start with your hair first. I'm just going to take a look at your scalp. I'm just feeling for any lumps, any bumps, any masses. Do you have any tenderness with palpitation at all?
No.
With me touching it? Okay. I'm just looking at your hair. I'm looking at the texture of it. It looks like it is well dispersed. I don't see any thinning. I don't see any alopecia at all. Everything looks well. I'm not noticing any infestations, nothing along those lines. You don't have any problems with your hair at all?
No.
Okay. So the next thing that I'm going to do is I'm going to go ahead and palpate your face. Are you able to remove your mask for me? So the first thing that I'm going to do is I'm just going to go ahead and, are you able to feel that?
Yes.
Go ahead and close your eyes and tell me where I'm touching.
Left cheek.
Perfect.
Chin.
Good. So you can go ahead and open. Next thing I'm going to have you do is kind of clench those teeth for me. Clench them. Good, good, good. Just feeling. So what I'm doing is I'm testing for a cranial nerve. So I'm looking right now, I'm testing for the cranial nerve 5 and 7, which is your trochlear nerve and your facial nerve. So the next thing that I'm going to do is I'm going to kind of make some silly faces at each other.
Okay.
So go ahead and smile, frown, puff those cheeks out, squint those eyes, raise your eyebrows up, and then you clench your teeth. Good. Go ahead and open up your mouth and close. Perfect. I'm just going to take a feel at your carotids. Good. And the carotids are equal at a +2 each. The next thing I'm going to do is I'm just going to kind of press on your sinuses. Do you have any pain at all in the sinus areas?
No.
Oh, wonderful. Okay, so now I'm going to start kind of getting into specifics. I'm going to start with your nose. So the first thing that I'm going to do is I am going to inspect your nose. I'm just looking at the symmetry of your, just making sure your nose is even on both sides. And it looks very good. Your bridge is very aligned. I am going to look kind of inside. I'm not seeing any deviation of your septum. I'm not seeing any masses, anything in your nostrils. That would be concerning. Go ahead and cover one of your nostrils up and blow air in and out of the other one. Okay, good. And opposite. Good, and no problems with that at all. I'm hearing airflow go in and out, which is good. The next thing that I'm going to do is I'm going to have you close your eyes. I'm going to place something underneath your nose, and I would like for you to tell me if you could smell it. Go ahead.
Barbecue.
Yes, wonderful. You can go ahead and open. So what I was doing is I was checking your cranial nerve 1, your olfactory nerve, and it's intact. I don't see any concerns at all with it. The next thing that I'm going to do is I am going to go ahead and take a look at your eyes. So what this light is it's a light that I'm going to shine into your pupils, and it's going to let me see that optic nerve in the back, okay?
Okay.
So first I want to measure your pupil size with my pupil size measurer. Good, good, and it's about a 4, which is normal. So we'll go ahead and I'm just going to have you lift your glasses up just for a moment. I'm just going to look at your optic nerve, so you can go ahead and just look right at me. Perfect. Wonderful. and it looks, well, you can move your glasses back down. Looks like your optic nerve is intact. The next thing that I'm gonna do, are you okay? I know that light's kind of irritating. I'm just gonna kind of feel around your eye structures before I start getting into your visual acuity tests, okay? So I'm just feeling the lacrimal gland right now. Any pain or tenderness at all with that?
No.
Okay, I'm just gonna raise your eyes up. I'm looking at the sclera on top and bottom of each eye. I'm not noticing any redness, any yellowness, no conjunctiva. It looks like no jaundice. Clean white, perfect, beautiful. The next thing that I'm gonna do is I'm gonna go ahead and test your the directions. I'm testing which directions your eyes, making sure that they can go in all cardinal directions. So I'm gonna have you go ahead and focus on the tip of my pen and follow the light with my pen with just your eyes, okay? So we're gonna go ahead and go over, over. Okay, continue to follow, perfect. So the next thing that I'm gonna have you do is just go ahead and focus on an object behind me. I'm just gonna check your pupil reaction. Wonderful. Very good. So they are both equal, round, and reactive to light. So what I was doing there when I was checking all those directions of your eyes is I was looking at different cranial nerves. So those combined together, we are looking at cranial nerve 3, the oculomotor, 4, the trigeminal, sorry for my pronunciation, and then 6, the abducens, okay? So those are just big fancy words for nerves inside your brain that seem to be all intact.
Okay.
The next thing that I'm going to have you do is go ahead again and focus on an object behind me. And I'm going to have you place one hand in front of one of your eyes. Very good. Go ahead and lower it. Wonderful. And again with the opposite eye. Very good. And go ahead and lower it. The next thing that I'm going to do is I'm going to look at your visual acuity with my little Rosenberg test. So what this test is made for, we're going to put it about 14 inches from your face. Go ahead and hold it like this. Very good. And go ahead and read with both of your eyes open. Read as far down as you can. Just these letters.
L, T, B, S, N.
Perfect. And go ahead and cover one of your eyes and do the same thing.
N, H, T, U.
Wonderful. And uncover and cover.
N, H, T, U.
Perfect. And it looks like I noticed that you are wearing glasses. Are those prescription lenses?
Yes.
Okay, so it was 20/20 vision in both fields and in left and right with your glasses. So that's awesome. I don't see any need to, just make sure you're going up to your regular follow-ups with your eye doctor. So no concerns noted with your eyes. Everything looks really good. They're equal on your face. In general, everything is equal. Your eyes are equal. Your ears, everything looks equal, symmetrical. Your skin temperature is nice and warm. Your skin is intact. I'm not noticing any bruises, any lesions. Everything looks very good. The next thing that I'm going to do is I'm going to go ahead and look at your ears. I'm just going to feel around on your the outer ear or your auricle. What I'm doing is I'm just inspecting it and making sure that the skin is even, it's pink. I'm not noticing any masses, any bruises, any lesions. Does that hurt at all when I'm touching it?
No.
Okay. It looks very good. Wonderful. The next thing that I'm going to do is I'm going to take my otoscope and I'm going to look inside of your ear. What I'm looking at is I'm going to look at your tympanic membrane, otherwise that eardrum. Okay, so this is also a cranial nerve, and it is your acoustic. So we're just going to take a peek inside, and let me know if you're having any pain or tenderness with this.
No.
And your tympanic membrane is intact. It is pearly with color. I'm not noticing any redness in your ear canal, and I was able to see my cone of light. Looks very good. And very well on this side is very good on this side as well. The next thing that I'm gonna do is I'm gonna go ahead and take a look inside your mouth. So I'm just gonna change out my gloves because I've been kind of touching everywhere on your face, and I just want to make sure I got nice clean hands and clean gloves on because I have to feel around in your mouth a little bit, okay?
Okay.
Do you have any problems at all with your mouth?
No.
Okay. Okay, so the first thing that I'm going to do is I am going to have you open up your mouth, and I am going to just look inside of it. I'm going to inspect everything. I am going to look on the sides. I'm not seeing any lesions. I'm not seeing any bumps. I am going to go ahead and count your teeth. Your teeth look good. So you have all your teeth. I'm not noticing any dental caries. Look very good. Go ahead and stick out your tongue for me. I'm just going to press down on the blade. Your tongue is moist. It's pink. And go ahead and I'm going to put this on the side of it. Can you push your tongue against my blade? And again, and what I'm looking at right now is your glossopharyngeal and your hypoglossal nerve. Okay, go ahead and stick your tongue out. Say ah. Wonderful. Your uvula looks good. It's intact. And I'm just going to press onto your gag reflex, okay? Oh, there. It's intact. Sorry about that. The next thing that I'm going to do is I'm going to have you go ahead and close your eyes. And I'm going to give you something to taste, okay?
Okay.
Okay, go ahead and close your eyes. Here you go. It's kind of a large chip. I'm sorry. What does it taste like?
It's barbecue.
Yeah, it's barbecue. Oh, I apologize. Too funny. So the next thing that I'm just going to kind of, like I said, wash my hands again. I'm going to put on some new gloves just because I was kind of feeling around in your mouth and feeling that mucous membranes, and I was looking at your gums and making sure I didn't see any gingivitis. Just from feeling around in there, I want to change out these gloves. So the next thing that we're going to do is we're going to kind of backtrack to those ears because I want to take a look at some hearing tests, okay? So the first hearing test that I'm going to have you do is, or that we're going to do, is I'm going to have you cover up one of your ears. I'm going to whisper a word. And what I'd like for you to do is repeat that word back if you can hear it, okay? So just cover either of your ears. Okay.
Corn dog?
Yeah. Okay.
Rainbow?
Yes, perfect. The next thing that I'm going to do is I have a tuning fork, and I'm going to press it against your ear, and then I'm going to move it away. And what I want you to do is tell me which sound you can hear better, okay?
Okay. Oh, when it's next to my ear.
Okay, good.
When it's next to that ear too.
Wonderful. And that's normal. That's what we're looking to see. So I don't see any concerns with that at all. Now we're going to go ahead and we are going to kind of take a look at some range of motion and then just continue to work our way down, okay?
Mm-hmm.
Any questions or concerns at all? All right. So first I'm going to have you go ahead and tilt your head to the left, to the right, down and up. Touch your shoulders all the way. There we go. Up. Look up. Perfect. Do you have any pain at all with that?
No.
Okay. And then go ahead and turn that way and then this way. Very good. Any pain against the resistance?
No.
Okay. The next thing that I'm going to do is I'm just going to go ahead and kind of feel those lymph nodes.
Okay.
They're along the back of your head, your neck, your ears, kind of goes down to the clavicles. Let me know if you are having any pain when I'm pressing on them, okay?
Okay.
So I'm going to start back here. Your pre and post auricle. gonna go down, up along the neck. No pain up there?
No.
Okay, I'm gonna go on the submandibular. I'm gonna go down the chain on your neck. Up on your clavicle. No pain, tenderness up there?
No.
Okay, I didn't feel anything. Your lymph nodes didn't feel swollen to me. I'm just gonna go ahead and take a peek at your neck. I'm looking to make sure that your trachea is midline with the body and it looks good. It feels intact. Go ahead and swallow for me. Wonderful. And I'm just looking at your thyroid. And I don't notice any goiters. I don't notice any masses. Your skin is it's dry, not too dry, it's perfect dry. And it is pink, it's even. Again, no bruising, no lumps, no abnormal moles. Looks very good. The next thing I'm going to have you do is go ahead and kind of shrug your shoulders up. Good. I'm looking at your spinal cranial nerve, and it looks to be intact. I apologize. The next thing that I'm going to do is I'm going to take a look at some range of motion in your upper arms, and then we'll kind of just move on from there, okay? So I'm going to have you go ahead and put your arms out straight for me, okay, to the side, okay, and up. Perfect. Do you have any pain with that at all?
No.
Okay, I'm going to have you go ahead and do that again. Put your arms out to the side again and down. Can you go up? Wonderful. And go ahead and kind of flex that arm for me and put it back down. Any pain with that?
No.
Okay, and go ahead and kind of move that wrist up, down, over, perfect. And wiggle those fingers. Any pains at all? Any
No.
pain with the fingers? Okay. Go ahead and flip your arm over. I'm just going to feel your pulse here, okay? Very good. Any pain at all in your pulses?
No.
Okay. I'm gonna check now for discoloration on your hand. I'm gonna be doing what's called an Allen's test. I'm just gonna kind of see look at the circulation in your hands, okay? All right, very good. And can I see your other hand? I'm gonna start with the Allen's test on this one. Very good. I'm gonna feel your pulse. Feel your pulse. Okay, I'm just going to compare your pulses. All right, the +2, and they're equal on both sides. I'm going to have you go ahead and kind of wiggle this wrist around, wiggle those fingers. Good. Any pain? I'm not noticing any grinding, any joint, nothing, no popping, no clicking in any of your joints. Go ahead and flex. Okay, and there you go. And again with the shoulder, we're going to go out, down, up. Wonderful. Next thing I'm going to have you do is go ahead and put your arms straight out again. And I'm going to have you push against me. Good. In. Good. Down. Up. Squeeze my hands. Perfect. Everything looks very good. Range of motion ×4. In upper extremities, I'm not noticing any concerns. The next thing that I'd like to do is I would like for us to just go ahead. I'm going to continue doing range of motion, and then I'm going to have you stand up, and then we're going to sit back down. And so we're just going to kind of go a little bit here and there. So I'm going to do range of motion on the lower extremities. I'm just going to have you go ahead and lift your foot up and down. Any pain at all with your knee?
No.
Okay, and again, down, good. And flex that ankle, okay, and put it down. And flex that ankle, and put it down, good. And go ahead and you can move it in a circular pattern. Oh, very good. No grinding. I'm not noticing that it's grinding. It doesn't, I don't hear any clicking. Very good. The next thing that I'm going to have you do is I am just going to have you stand up. I'm going to have you kind of bend over and take off your shoes. What I'm going to do while you're doing that is I'm going to just look at the your spine and making sure that it is that it is even. I'm not noticing anything. I'm not noticing any curvature. Your back is clear of any lesions, any moles, any lumps, any bumps. Your skin color is even and your temperature is normal. You can go ahead and stand up. I'm looking at this, the symmetry of your shoulders to your hips, to your feet. It looks very symmetrical. It's even. I'm going to have you go ahead and turn towards the wall and walk towards it and come back to me. Good. Your gait is even. I'm not noticing any sort of curving, anything unusual. the next thing I'm going to have you do is I'm going to have you go ahead and put your arms out in front of you and close your eyes. Wonderful. You can open them. I'm going to have you stand on one foot and with the opposite hand, put your finger to your nose and switch. Very good. Your balance is good. I'm not noticing any swaying or anything uneven. You can go ahead and sit down. I'm just going to kind of finish taking a look at your feet. I want to just check out some pedal pulses real quick, okay? So I'm just looking at your pedal pulses. They're equal bilaterally with a +2. Very good. The next thing that I'm going to do is I'm just going to take a look at some reflexes. So I'm going to kind of start up and start down here and work my way up, okay? So the first reflex that I'm going to look at is your Achilles tendon. So I'm going to need you to flex your foot up, yep, and you're going to feel a tap on the back of it, and it shouldn't hurt. Let me know if it hurts at all though, okay? Good. And again. Good. And then I'm going to go to your knee. Good. Good. All right. I'm going to check the strength real quick while I'm down here. Go ahead and push those legs out against me. Push them in, up, or down, I mean. Up. Very good. The next thing that I'm going to do is I'm going to start with your reflexes on your hands. Can I see your wrist? Believe it or not, you have a tendon pretty much all over your body, but you have a little tendon right here. And I'm just going to, on your wrist, and I am going to test the reflex, okay? Go ahead. Very good. And then I'm going to test your brachial. Go ahead and we're going to flex real quick.